Now let's start right away. We will, if you can hear me, put a 1 on the screen. I think a lot of people get 1 now. Okay, I want to welcome everybody. First of all, we'll welcome people from, I saw a lot of people from very different places. They're from Hawaii, they're from Singapore, they're from Philippines, they're from Hong Kong. Wow, a lot of people. Oh my goodness, this is really cool. All these nice people, and I'm so happy for you to join us. 今日好高興啦，有好多人join 咗我哋啦，有 people from Hawaii 啦，有 people from Hong Kong 啦，有 people from 菲律賓啦，亦都有 people from 新加坡啦，哇，好多不同人士啊，好正。咁 anyway 咧，今日咧我哋講緊咧呢個 topic 咧就係 how do you take steps to prevent 呢個 serious diabetes。咁我哋咧其實咧就係呢個係一個十分重要嘅，我覺得係一個十分重要嘅 program。能夠令到你啲人咧係知道OK，how am I not to get worse？ 聽唔到 ？OK， good. The sound is okay, right? If everybody sounds okay, can you put a 1 again? Just want to make sure everybody the sounds all right. 如果個聽到之後咧，個俾個聲1，我哋得唔得 ？1， 俾個 1。哦 ，good. Okay, everybody can hear. Good, excellent. 嗱，我今日咧有Professor Chan 喺側邊啦。咁Professor Chan 咧就教咗好多年喺香港大學同埋中文大學同埋我哋嘅家庭醫生家庭醫學院裏面好多即係我哋家庭醫生都係教出嚟嘅。咁佢亦都寫咗好多 paper 啦。咁所以變咗喺呢方面咧係十分一個好有資格嘅又好有即係 knowledge base 嘅教我哋咩叫 diabetes 啦。咁好高興，好特別揾到Professor Chan 揾我哋傾偈嘅今日。We are so honored to have Professor Chan actually give us what is diabetes and how not to get serious diabetes today. And Professor Chan actually trained many family medicine doctor, wrote a lot of paper, what is diabetes, and able to actually give us that knowledge. So you won't get, serious diabetes, and that's what he will able to do us today. Really a great honor to have him to join us because very rare to be a professor. He's a very excellent lecturer. I listened to quite a few lecture because I sit in quite a few of his seminar teaching the family medicine. So without any further delay, I'm going to start the program with Professor Chan. And Professor Chan will speak English and I will speak Chinese, okay? So let's start.
Thank you, Andrew.
Okay, let me put this over. Okay. Okay, so we will move the slides up this way and then,
Share screen.
Okay, now, okay, good. Here we go. Now I'm going to share the screen and, sorry, we'll start off this way. Okay, so Professor, go ahead, please.
Thank you. Thank you for giving me the chance to teach a big group of from various countries of people. So basically, today's concept we will divide it into 9 aspects from the very beginning with diabetes and pathophysiology of diabetes and who are at risk, prevalence of diabetes as well as symptoms and signs, how to screen diagnosis of diabetes, and how to prevent. Hope to help every one of you. Let's go to management for diabetes and for the management of non-pharmacological and pharmacological. I will talk a bit more on this part, and also the most likely the nowadays patient-centered approach of DM management will be also being touched base.
嗱，今日咧我哋好特別啦，我哋個 topic 咧就第一係講及乜嘢叫做糖尿病啦，同埋佢個糖尿病嘅病理係點樣啦，咁仲有咩人組係可能有好大嘅風險啦，同埋第二樣咧就係糖尿病依家併發率係點樣啦，仲有咧糖尿病嘅症狀係點樣啦，同埋仲有咧糖尿病咧如果係診斷咗之後，你係自己係咪可能夠monitor 咧點樣度血咧，能夠令到你自己知道我依家糖尿病去邊度咧，同埋仲有係咪可能夠有一個糖尿病嘅預防咧？仲有我哋現在糖尿病嘅病者咧係點去管理，同埋我哋目標係做啲乜嘢咧？ 同埋仲有一樣嘢咧，Dr. Chan 咧仲要講埋咧，糖尿病如果係用藥物點醫咧，唔用藥物點醫咧？最後啦，仲有一個咧好特別咧，就現在嚟講咧，講糖尿病咧係一個傳導一個團隊化去知道點去管理呢個糖尿病嘅。咁呢個就係今日嘅 topic 啦。
So to start with, what is diabetes? Diabetes means that if your blood glucose is higher than normal. In most of the senses, this is called greater than 7 millimole per liter.
OK， 咁糖尿病係咩叫糖尿病咧？其實糖尿病咧好簡單，即係糖尿病咧，如果你個fasting blood sugar， 即係空肚嘅血糖啦，係多過7嘅話 ，millimole MOQ 咧，咁其實啲糖尿病，如果係喺我哋嘅即係 conversion 裏邊咧，就大概120度啦。美國就120度啦。United States is 120。You have 120 milligram per deal, and you are diabetes.
Yes.
Okay, next slide. Okay.
Yeah. So the blood glucose and the body, basically, every one of us need to take food from, and we get the sugar and glucose from our main energy source from the food, and then when the food enter into your from the mouth into the stomach, and then it will be digested, and later on it will be absorbed from the intestine to your blood for your energy using. While in the same time, your pancreas will produce insulin to lower the blood glucose. So, and insulin is a very good thing to keep your blood glucose within the normal range.
OK。嗱，我哋每個人食嘢之後咧，其實咧嗰啲食嘢咧就將嗰啲食物去到肚嗰度啦，即係個胃嗰度啦，然後去到大腸啦。咁大腸之後咧，嗰啲糖咧就會開始 absorb 入去啲腸嗰度噶啦。咁亦都excite 到咧有一樣嘢咧，就係你個胰島素啦，就會泵啲insulin 出嚟咧，就幫你啲糖咧帶佢入去咧你個啲血管裏邊嘅。咁其實咧呢個咧就係所有食咩都好啦。你都會將你嘅食物係轉咗佢係糖，然後咧就 absorb 你血糖裏邊，然後你嘅胰島素咧就喺個 pancreas 即係胰臟嗰度泵啲insulin 出嚟，即係胰島素出嚟就幫你入到啲糖去。咁所以如果你個胰島素一定係有一個係即係一個正常嘅，咁你就真係健康啦。如果你胰島素唔係正常嘅，即係亦都唔夠胰島素，你啲糖一定會高嘅。
And in the body, the pancreas is the beta cell to produce the insulin.
嗱，其實喺嗰個好特別咧，有一個咧喺個 pancreas 裏邊咧有 A 同 B cell 啦，個 beta cell 啦 ，beta cell 就係我哋做胰島素個 cell 嚟嘅。
So this is the figure to show that for us, we will take breakfast, lunch, and dinner in various time, and after taking the food, your blood glucose will shoot up. And in the same time, your body, the pancreas, the beta cell will release the insulin to suppress the blood glucose towards a relatively normal range to make the balance inside the body for the blood glucose.
OK， 嗱，其實我哋每日食飯咧，你都睇到啦。咁我哋食飯朝頭早咧就會食咗出嚟啦。咁就會糖會高啦，食完晏晝又好高啦，然後晚黑又好高啦。胰島素一樣咁嘅情況咧，又泵一齊出嚟咧，亦都係喺個血管裏邊咧有胰島素，咁裏邊咧又係跟住你食物嚟走嘅，咁所以變咗嚟講，你食多啲嘢，胰島素喺度泵咗出嚟。依個 all time 係咁嘅，晚黑你冇去食啦，咁胰島素就 stay the same 啦 ，evening 就係。
And this is a very important slide among my talk. Basically, this is a slide so that in the recent 10 to 20 years of medicine, the most belief about the diabetes and what is impaired glucose tolerance is basically on this slide. And it talk about insulin resistance and the beta cell dysfunction towards the diabetes development. Let's say if people, most of type 2 diabetes, they start with obesity. People like to eat food, especially quite a lot of carbohydrate, fatty meat, and then they get more and more energy inside the body, become fat, and then later on you may heard about IGT is impaired glucose tolerance, and then later on develop into diabetes and ultimately become uncontrolled hyperglycemia. How does this interpret in the figure? If you take quite a lot of food, just the previous slide we mentioned about, you will have shoot up the insulin, but with more food, taken, your insulin, your pancreas will become insulin decrease the sensitivity and also in the same time increase the insulin resistance. Your body by itself can compensate by pump out more insulin. And then during that time, you get the balance and your blood glucose will not increase quite a lot, both fasting or postprandial. But with time, your pump getting more and more worse, just like the pancreas, just like a car engine getting fatigued. And they start to decline. It's called pancreatic failure. And when the time the pancreas insulin reduces, decrease, your postprandial glucose shoot up first, and then later on follows by fasting glucose. And then after around 10 years, your pancreas function is less than normal, less than 100, and become more and more failure. Then your blood glucose is hard to control and ultimately become uncontrolled hyperglycemia. So this is the years of diagnosis. So many people think about when you have been diagnosed diabetes, before that 5 to 10 years, you may have impaired glucose tolerance. So if you have been diagnosed or told to be impaired glucose tolerance, you should be more alert because with time, you may have diabetes. And also after diagnosis of diabetes, with time, clinical diagnosis, 10 years, you may suffer from pancreatic failure. And also why is this important? Because people may have ultimately not just can control the glucose control by drug itself, they need to put on insulin. So basically, this is a very long story, but it's a very important concept about the insulin resistance as well as beta cell dysfunction.
嗱，覺得記住啦，胰島素裏邊有個 cell 嘅 B cell， 個 B cell 咧就製造咩啊 ？insulin 胰島素出嚟嘅。咁當然你肥胖嘅時候咧，食嘢咧就可能夠一路咁就食咗之後啦，咁你個 glucose 上嚟啦。嗱，初期咧就即係 OK 喎，因為點解咧？初期你胰島素計啦，泵可以泵到胰島素出嚟，咁就幫你放啲糖入翻你 cell 數啦。嗱，當你某間年後咧，你個胰島素咧越整咧就越少喎。咁但係咧，仲有一樣嘢咧，好特別咧，就胰島素開始有個 resistance， 即係有抗拒啊。就算你泵咗胰島素去咧，佢都帶唔到啲糖入去個血嗰啲細胞裏邊。咁但係你咧食咗嘢之後咧，嗰啲糖咧越整越高喎。仲有一個咧，去到5至10年後咧，仲有弊處咧，就係嗰啲胰島素咧整下咧，啲胰島素就好多 resistance。第二，你個即係胰臟啊，即係你嗰個胰臟咧開始就嚟做啲胰島素出嚟，越整越少，因為佢已經整到差唔多，已經係差唔多冇嘢做啦。咁整下咧，佢個胰臟就係出唔到胰島素添。咁嗰陣時咧，即係10年後咧，你其實咧就食藥都唔得啦，因為咧變咗嚟講，最後咧就係點啊？你冇咗胰島素啊！咁你胰臟都唔出胰島素啦，咁你就變咗要打 insulin 啦。所以有好多人咧係會 end up 咁嘅嚇。咁所以變咗嚟講咧，即係控制血糖係好緊要嘅嚇。
Yeah, so if you know this figure well, then you know why some people can be controlled by diets, while some people can put on drug, and while at the later stage you need to put on insulin. And also, I would like to stress again that if you have been told that you have some sort or you know yourself is obese, and with the diagnosis of impaired fasting glucose, IFG or IGT, impaired glucose tolerance, then you still have time because before the clinical diagnosis of diabetes, if you work hard, by all means, let's say exercise or diet, we will talk it later on, then you can try to delay your insulin becomes fail and not secrete more insulin. That is good for you. So remember this line.
OK， 仲有一個重點咧，就係我哋呢個 intolerance 啊 ，glucose intolerance 啊，即係話你個嗰個血糖咧整下都係唔夠嘅，因為食咗好多嘢咧，咁但係食咗都出唔到嚟啊。咁但係你唔想去到呢個 stage 先做嘢，咁其實咧最重要嗰陣時咧，喺個未到 glucose intolerance 之前咧，你做 exercise 啊，令到個胰島素唔會好多抗拒啊。同埋令到個唔使話要用好多胰島素出嚟啊，或者你肥胖咧，亦都減低你肥胖啊，食嘅嘢唔好好多糖咧，咁呢個時間咧係可以用到你控制幾樣嘢咧，就 exercise 啦，唔食咁多甜品啦，唔好食咁多即係所謂叫做 carbohydrate 啦，嗰陣時係控制到嘅。如果你唔做嘢嘅時候咧，當你去到呢個情況，個胰臟已經唔係好㗎啦，嗰啲胰島素繼續唔出嚟咧，咁就弊家伙啦，因為嗰陣時咧就係真係要打針啦。OK， 即係胰島素打針啦。
So why does the beta cell fail? Basically two things. One is glucose toxicity, and the other thing is lipotoxicity. When you have put in yourself into quite high carbohydrates, we call it chronic hyperglycemia. That means your blood is full of quite a lot of blood glucose. Or in the same time, you're not just taking too much carbohydrate, you will take quite a lot of meat, especially the fast food, hamburger, that's called fish and chip, French fries. Then you're also putting your cell into high circulating free fatty acids. Free fatty acids by itself is called lipotoxicity. Both this toxicity will further damage the pancreas, causing beta cell dysfunction. And with the time, you also, because you take quite a lot of food, just the previous slide we're talking about, you have over secretion of insulin to compensate the insulin resistance. Then all these things further damage the beta cell dysfunction. Just like a bomb, the car is very old, but you try to deteriorate, and then you try to step a bit more to try to make the car move faster, just like this. And ultimately, your car cannot move and broke down. The pancreas just similar to the thing. You could not take quite a lot of food and cannot and have no chance to lower your blood glucose, lower your food intake, then ultimately your pancreas will fail, just like the car engine.
OK 嗱，咁記住咧喺個胰島素胰臟裏邊咧有兩個 cell， 一個叫 A cell 個 B cell 啦。咁依家就講 beta cell。咁 beta cell 咧好特別咧，如果你個身體個血管裏邊成日都係好多糖嘅咧，咁你就有一個叫做 glucose toxicity， 即係話有個血糖毒血症。咁其實咧呢個就開始 damage 你個即係破壞你嘅胰臟嘅。咁另外一個咧就係有個如果你成日食呢個嘢好肥嘅，即係肉啊、牛肉、豬肉啊，食得好肥嘅。咁其實另外一個咧就會有另外一個問題咧出現一個叫 lipotoxicity， 即係話係脂肪過多同埋會有毒啦。咁呢個亦都會破壞呢個胰臟嘅。兩樣嘢破壞胰臟咧，咁就會令到你個 beta cells 咧亦都會壞。即係話如果你繼續做呢樣嘢嘅時候咧，你就算係即係你個 beta cell 唔 work 嘅話，咁你啲胰島素唔出嚟喎，因為佢係製造胰島素㗎嘛。咁變咗嚟講咧，呢兩樣嘢做埋一齊咧，就幫你係令到你胰島真係唔到嚟嘅。咁你就變咗真係血糖一定繼續高啦。
So you want to protect your pancreas by reducing the beta cell dysfunction, try to reduce your blood glucose as well as your fatty acid.
咁所以變咗咧，最重要咧就係你真係要需要咧，係幫助你咧唔好 damage， 唔好破壞你嘅胰臟，就令到你唔會有呢個 glucose toxicity， 即係話嗰個血糖嘅敗血症啦，同埋你個膽固醇高啊、lipo 啊嗰啲即嘅toxicity。咁兩樣咧就唔會 damage 嘅 beta cell， 咁你就可能夠繼續。即係令到你胰島素繼續行，唔出胰島素啦。
Yeah, so this is the basic concept.
係。
And so what do we know about the type 2 diabetes? Basically, is insulin secretion reduced, not enough insulin, or because decrease the insulin sensitivity, or it's called insulin resistance. And this is a kind of chronic disease that continues to deteriorate. Some people call it degenerative disease. Okay. Endocrine disease
嗱，所以咧其實咧好重要咧，有兩種方式咧，你要真係好記得嘅。第一種方式咧就係你 insulin 整下唔夠嘅，咁一路咁 decrease 落嚟啦。另外一個咧就係你個胰島素裏邊嗰啲細胞，即係 B cell 啦，唔製造胰島素出嚟，或者佢個胰島素個 cells 係去唔 respond， 即係你個 cell 本身係唔 respond 啲 insulin， 咁啊變咗 insulin 繼續 resist 喎，咁變咗嚟講咧。你 insulin 繼續 resist 嘅時候咧，你最後咧就係你嗰個呢個變咗係長遠一個慢性咧，係將你個胰島素同埋胰臟咧度退化。
So there is two types of insulin, and we will touch a bit more on type 2. But type 1 is people totally low insulin, and then they depend on insulin injections to compensate the diseases. Type 2 is relatively less, okay, with time, and most of us have diabetes, type 2 diabetes. And both of them will cause the blood glucose level high.
嗱，其實咧喺糖尿病者裏邊咧有兩種糖尿病啊，第一個 type 1啦，咁 type 1就係全部冇晒 insulin 啦 ，type 2咧就係你仲有即係 insulin，但係因為慢慢落去咧就繼續差嘅，咁就變咗兩樣都係令到你個血糖一路咁高。
So for type 1, we just briefly mentioned about basically it's young diagnosis. Some people when we are doing the pediatric, some even newborn baby and or kids and child age have diabetes, and most of them not obese and no family history. But type 2 very common in nowadays. Many people is develop type 2 with middle age or elderly, and most of them have overweight, obese. Even some may have weight loss and lean, but before they lose their weight, they may have obese or overweight before. And many of them have family history, but not totally. This is may not be absolute, but they can be intervened between each other.
嗱，今日咧講多啲咧，其實我哋有兩種糖尿病病者，第一個type 1啦，就多年輕化嘅，個 BMI 咧就唔係肥胖嘅，同埋咧佢多數係冇家庭背景嘅嘅人咧係有糖尿病嘅。但係今日咧我注重多係講 type 2嘅，type 2咧多數就middle age 嘅，即係中老年嘅人啦，即係40歲到上去60、78歲嗰啲啦。咁但係佢多數好多人咧就肥胖啦、超重啦，同埋咧好多人咧喺家庭上咧有啲成員都有糖尿病嘅。咁呢兩個就係雖然唔係絕對啦，但係呢個就好多時咧 type 2嘅病人就係咁出現㗎。
So the development of type 1 should be most of time because they lack of insulin, so the duration of disease is very suddenly and then come out and also present with diabetic coma or diabetic ketoacidosis, and definitely they need insulin. While type 2, they can be developed over month and year. Just the previous slide, we talk about the slide, the curve, it can be about 5 to 10 years, and they seldom develop any diabetic coma. And most of them may not need insulin at the moment of diagnosis, but with time, around 10 to 20 years, they may need. And also, quite a lot of people have gestational diabetes. They may have, during their pregnancy stage, they may have already diabetes.
OK， 嗱，我哋今日講咧最重要咧講 type 2啦，因為 type 2咧多數嘅人咧都係症狀裏邊咧就係一路慢慢出現嘅，即係因為一個時間係越年㗎啦，即係嚇。咁第二樣嘢咧，好多時咧佢哋係 type 2咧就多數咧係冇即係佢多數咧唔會有diabetic coma 嘅，唔會暈咗嘅。亦都咧可能咧就唔係話一定需要胰島素打針嘅，同埋咧diabetic咧嘅人咧好多時咧係因為佢有個生細佬哥嘅時候糖尿病，然後冇咗之後將來就有翻糖尿病。咁所以 type 1咧就好快出現嘅，就好即係佢多數係好呢個好快出現嘅人嚟嘅，同埋咧佢好多時咧就會有個即係 ketoacidosis 嘅暈啊，同埋一定係需要打胰島素嘅。
So this is just summary chart, and we skip it. So in terms of the figure, yeah, type 1 most of them is young, suddenly have symptom and limb. Type 2 and most of them are adults and may not have symptoms at the beginning, and most of them are obese.
So 我哋依家講啦，嗱，如果 in conclusion 啦，就 type 1咧多數就係young嘅，好後生嘅，同埋忽然間出嚟嘅，同埋多數瘦嘅。但係重要點咧就最多人 type 2啦，因為多數啲人咧都係大人啦，同埋咧佢多數咧係初期亦都冇咩症狀啦，後尾咧就會好多時好多人都係好肥啦，咁多數係咁樣出現嘅。
So who are at risk for type 2 diabetes? Some of the risk factors irreversible. We cannot help. We cannot change. Let's say aging. By all means, age is a definitely risk factor for diabetes with people with aging. And certain ethnic groups, such as Asian, ourselves, African, and American Indian, and family history of diabetes. And women who have diabetes during pregnancy or have a big baby born more than 9 pounds.
OK， 嗱 type 2 diabetic 咧多數咧就45歲以上嘅人啦，同埋咧仲有咧好多係喺即係亞洲人啦、非洲人啦，同埋啲印度人啦，同埋印度人啊。咁同埋好多係喺佢哋嘅家族裏邊有個呢個糖尿病者嘅，嗱好多係女士咧啱啱生 BB 嗰陣時候咧，佢個 BB 係多過9磅咧，個 chance 之後佢有呢個懷孕嘅糖尿病係高嘅。
But we are more focused on reversible risk factor, especially as a doctor. We always want to help people who are obese, or who have been diagnosed impaired fasting glucose or impaired glucose tolerance, to convert yourself, avoid developing into diabetes by all means. Let's say if you're obese or overweight, or you are physically inactive people, or who are on high risk of or hypertension or hypercholesterolemia, then you should take care of yourself and avoid, by all means, we will tell you later, try to avoid to become a diabetes.
OK， 嗱。其實今日咧，我哋注重咧都係講及咧，就我哋可唔可以呢啲咁嘅type 2嘅病人咧，能夠改變咗佢，能夠即係醫到佢啦。咁當然啦，呢個醫好佢咧就係 第一佢要減重嘅肥胖啦，或者佢係缺乏咗一啲運動嘅人啦，同埋咧仲有佢個血糖同埋唔係應該佢個 blood pressure， 即係佢血壓高啦，同埋佢膽固醇都高嘅。咁呢啲全部可以 reverse 到嘅，咁所以咧就會幫助多啲咁嘅人咧，係能夠令到佢即係可能夠解決咗佢唔會將來永遠都係嗰個 type 2糖尿病或者更加深嘅糖尿病。
So this is a summary of the risk factor we have mentioned about, and this is the by figure we can also show that what kind of people with high risk, and we also touch it a bit later. And dietary change, just a very interesting figure. The urbanization and industrialization in the whole world is around 100 to 200 years, but before that there is more than 1,000 years. The people is doing some sort of hunting or agricultural or fishing industry. With more industrial and automation, people become more and more enjoy life and sedentary lifestyle. They can do just like us. We may just doing some sort of paperwork and admin work and sitting all around while it's easy to get the food. And then with time, getting more and more obese and become the risk factor for diabetes.
嗱，我覺得呢個測咧都好特別啊！即係睇個食物咧，近時我哋即係叫原始人啦，即係打獵啊咁嘅身體就十分健康嘅。嗱，當我哋到老啲嘅時候咧，弊家伙啦，因為我哋咧就唔係成日做嘢啦，亦都唔需要打獵啦，喺公司淨係做紙張嘢啦，又食嘅又好唔係健康啦，咁就變咗即係糖尿病嗰個發生咧就好高啦。
So prevalence of diabetes around 1 in 10. There is already called the 1 in 10 adults in Hong Kong have diabetes. Also similar figure in China, and also is increasing from 9.3 to 12.1. And while Asian is relatively difficult because Asian with type 2 diabetes were relatively compared to Caucasian, they will predispose to renal complication, end-stage renal failure or stroke.
嗱，其實喺香港咧，10個人之中咧已經1個係糖尿病病者啦。嗱，前期患者仲勁啊，230萬人啊 ，2.3 million people。咁其實中國都一樣嘅。咁其實依家咧，你睇到中國咧，由2011到依家咧，近時係9.3，依家去12.1%，即係高到好鬼快喎。如果去2030就去12.1喎。咁其實呢個數字因為係咁加上去嘅。咁仲有好多呢啲即係第二嘅糖尿患病者咧，係前期患病者咧，係個數字係好高嘅。咁呢啲人咧，仲有一個風險咧，就係咩咧？好多人咧會 end up 就有 stroke 同埋呢個腎病嘅病咁其實都呢個係有好大風險嘅。
So we have a look about the population health survey performed by Department of Health Hong Kong 2014-9. It showed that by telephone survey about a few thousand of Hong Kong people, around if you get aging, 22.7% or even 16.6% of elderly will have diabetes. While general population, the general can be around 5.5%, but this is by telephone call. So this shows that with aging, the prevalence of diabetes increase.
OK， 亦都睇到咧，呢個係香港嘅統計啦。22.7% 嘅人咧係喺75至80歲咧已經係糖尿病病者啦。咁如果65歲咧就 16.6 啊。咁其實總個 population 就 5.5 嘅。咁其實呢個都係可以，即係你哋見到越老咧就越多人有喎。所以變咗嚟講啊，我哋依家亦都好注重咧。當你過咗60零歲嗰啲，如果你糖尿病係好個 chance 係高嘅。
And how about the global? You can download and you can search the internet about IDF, International Diabetes Federation, Diabetic Atlas, and most updates 2019. These figures tell us that with the 2019 and forecast about 10 to 15 years later, there are 51% increasing chance of diabetes prevalent in the world. The more high-risk areas is Africa, Middle East and North Africa, and Southeast Asia, but the Southeast Asia is not our friends Philippines, Singapore, Malaysia. This is India and Pakistan. While Hong Kong, China, Australia, and Philippines we belong to the Western Pacific. This is similar to WHO definition of, but basically this three area is at high risk of developing diabetes and it's increasing.
OK。咁你呢個 chart 咧睇到咧，呢個喺IDF 啦 International Diabetic Federation 嗰度咧睇到呢個 chart 咧，其實世界咧越整越上咧，即係嗰個 diabetic 嘅人咧係越整越高，係有51% increase 啊。咁其實呢個係好勁嘅。咁但係其實重要點咧，最整高咧就係其實 Middle East 一紮 ，OK， 即係喺嗰啲中東嘅地方啦。咁第二樣嘢咧就 West Pacific， 即係呢度澳洲啊同埋中國咧都係高嘅，有31%，但係即係中東係更加高。咁但係其實咧喺東南亞裏邊咧最高就係印度啦，巴基斯坦74%嘅。
So in terms of the forecast, in terms of top 10 countries, by all means, China is always the first because it's quite a lot of population, while Pakistan forecast will be catching up the United States to be first. So you can see the top 3 countries having diabetes is all in the Asia, China, India, and Pakistan, while other our well-known friends, Indonesia, and also some of the Asian and African countries also in the top 10, while United States still quite a lot of population.
Number 4.
Yeah, number 4. Yeah.
所以其實睇翻咧，其實中國咧同印度啊、巴基斯坦係最高㗎啦。將來喺2045年係好高嘅，睇到就係140。咁依家就116，但係將來147喎中國啊。咁但係將來喺依個亦都喺其他地方，美國都高嘅，因為美國依家係31個 million， 依家遲啲咧就36個 million。咁然後之後咧就係其他就 Indonesia 好高啦嚇。咁所以變咗嚟講咧，即係睇到個 trend 咧係一路呢啲10個國家裏邊咧全部都係高上去嘅，即係中國、印度、巴基斯坦同埋喺東南亞就係 Indonesia。咁啊，如果喺歐美咧最大咧就係美國啦。
So how to diagnose? Basically, people with diabetes may not have symptoms, and sometimes they just pick up or diagnosis by blood test.
嗱，其實好重要咧，知道咧，type 2 diabetic 好多時咧都係冇 sign symptom嘅，即係冇任何嘅症狀嘅，但係只係用翻血嘅測試咧就查咗出嚟，啊，原來你依家係前期患病者或者已經糖尿患病者。
So, but if you want to know more about diabetes, any symptom, then this is the typical symptom. Then, but this may not be happen. But typical symptom is you may feel very thirsty, frequent drinking, and frequent urination, or we like to go to toilet, and sometimes unexplained weight loss and easy fatigue, malaise, or blurred vision, and sometimes skin or genital repeated urinary tract infection or genital infection.
但係如果你譬如真係冇任何症狀咧，但係有啲人都有啲症狀嘅，多數啲症狀係咩咧？就話哇上尤其是咧到後期嗰啲咧個好緊渴啊，成日想飲水啊，同埋成日去廁所啊，尤其是夜晚成日都要上去廁所啊，同埋有啲人咧就以為淨係肥胖先係diabetic嘅，唔係啊，有啲人忽然間 lost 咗 weight 啊，即係個磅數輕咗好多啊，同埋成日攰啊。同埋咧個眼又蒙蒙地睇唔到嘢，同埋個身體個皮膚咧好多痕癢啦，同埋咧性器官嗰度咧亦都有好多發炎嘅跡象啦。呢啲亦都係患者嘅症狀嚟嘅，糖尿患病者嘅症狀嚟嘅。
So this is the figure. Just show you what is the symptom of diabetes: blurred vision, polydipsia. Polydipsia is like to drink quite a lot of water. And this is most of them is type 2, yeah, polyuria. Well, type 1 we will skip it, but type 1 is more complicated. Then they will have various kinds of acetone smell, nausea, vomiting, or lethargic. It's just a very simple slide to show the symptom. 但係咧，
其實最重要咧睇翻咧就係我哋好多時咧就係個好多人就即係眼蒙啦，睇唔到嘢啦，咁同埋咧就係會頸渴啦。第三咧就係好多係即係成日去廁所啊，咁呢個係一個好常見嘅diabetic即係糖尿病患者嘅問題嘅。
So people in Chinese 三多少 but it is easy to remember also in English 3 more and 1 less symptom: frequent drinking, frequent urination, and always frequently to take food while you will lose the weight and fatigue.
OK， 咁其實咧亦都即係喺呢度睇到啦，同頭先講一樣啦，好多人咧就成日頸渴啦，成日去廁所啦，仲係食嘅好似唔飽咁啦，仲有攰啦，同埋仲係瘦咗忽然間。
So we just mentioned about how to diagnose diabetes. If you have symptoms, then you can go to checks. But from the Hong Kong reference framework 2018, basically they take reference from American Diabetes Association. What sort of people should screen for diabetes? The first is age. If you have more than 45 years age and then you never be exposed to any checking for diabetes, then you may go to see your primary doctor or GP. Or any people with risk factor, we have mentioned about this, obesity, sedentary lifestyle, and also family history, and also history of gestation, history of diabetes at pregnancy, and any sign and symptom we have mentioned just before, polyuria, polydipsia, and also frequent urination or frequent infection. This sort of people should be proceed and go for screening. While the screening can be either fasting glucose or A1C.
OK， 嗱，其實咧，如果你係45歲後啦，或者你亦都覺得好多人咧係即係45又肥胖啦，咁啊你可能血壓高啦，但係多數啦，好多人未必有即係sign symptom嘅。但係如果有sign symptom，好似成日要去廁所啊，又飲嘢啊，失磅啊，咁同埋咧呢啲頭先所講嗰啲 symptom 咧，咁你就應該去個 family 上去 check 啦。咁有一樣嘢 check 咧，第一個就 check 咩啊 ？fasting 要做一個 check 個叫fasting glucose 啦。咁 fasting glucose 即係你唔食嘢之前就去讀個blood sugar 啦。另外一個咧就 check 你個 A1C 啦 ，HbA1C。咁亦都係血液做呢樣嘢嘅。咁所以變咗嚟講，呢個咧就 typical test。咁有冇一個叫做2-hour glucose tolerance test？
有呢度係嗱 ，so this is the first two screening tests, and then when you check the blood, they will have quite a lot of different results. So if you are lucky, less than 6.1 or less than 6, then you are relatively diabetic unlikely. While if you are 6.1 to 6.9, then you may have been either impaired fasting glucose or impaired glucose tolerance. And this is what Andrew just mentioned about oral glucose tolerance test. If you have impaired fasting glucose, your doctor may instruct you to proceed for the oral glucose tolerance test, depending on availability of the test as well as your acceptance. And the result, it will come out to be either unlikely to be diabetes or in between high fasting glucose but postprandial okay, then it would be called impaired fasting glucose. While you may have fasting glucose is also impaired fasting glucose, while also impaired postprandial glucose, then it's called impaired glucose tolerance. And some of people, after doing OGTT, their blood glucose postprandial is more than 11.1, which is very high. Then can be diabetes. And also, if you have checked the blood glucose, by all means, if your blood glucose is more than 7, then it's also diabetic. And also A1C, if it is more than 6.5, then it can be diabetes. So basically, 6.5 for A1C, fasting glucose 7, and OGTT postprandial 2 hours, 11.1. But there is a slash. That means if you have symptom, just one result, we can call it diabetes. But you have no symptom, no symptom, just go to body check. Then you need to be 2 value in diabetes range in 2 occasions for diagnosis. Put it in simple words. Just after this talk, you may scare about diabetes, and then you go to see the doctor and then have blood check. And then unfortunately, your fasting glucose is more than 7, let's say 7.5. Then no need to scare about diabetes because it's maybe, but we will advise you to recheck, let's say half year or 1 year later. And then after the recheck and then persistent, the fasting glucose more than 7 or still 7.5 for easy to remember, then unfortunately you will really have diabetes.
This is this is
OGTT, postprandial.
Postprandial, but you by blood test.
Blood test.
OK
Correct.
OK。嗱，今日咧呢個好重要嘅幾個 data 啊，第一呢個咧就係當你係譬如已經你個 fasting blood sugar 啊 blood test 篤咗有6.1啊，咁但係如果你6.1、至6.9咧，咁其實咧你就需要一個叫 oral glucose tolerance test， 即係佢俾一紮 glucose 去飲完之後咧，你最後咧就2個鐘頭再 take 個 test。就睇下你個血係乜嘢嘅，咁當然啦，如果你個血咧係6.1或者係飲完嘢7.8，咁你當然咪diabetes啦。但係如果你係6.1至6.9嘅係 fasting glucose 嘅，但係後之後咧就7.8喎，即係話飲完咗7.8啦，咁即係話你咧係有開始有些少糖尿啦，但係未到即係前期啦多數。但係如果你7.7呢個係你個 fasting blood sugar 多過7嘅。但係咧就係你個 blood glucose tolerance test 之後咧度完血咧就係7.8至11嘅，7.8至11即係去11咧就去到，如果喺美國咧就去200㗎啦，呢個200 OK。咁變咗嚟講咧，呢樣嘢咧，咁你就呢個係 impaired glucose tolerance，即係話你已經係做唔到呢個即係impaired glucose tolerance嗰個 test 合唔合格㗎啦。咁你咧就要開始做你 lifestyle change 啊，食嘢少啲啊，同埋唔好食咁多嘅 carbohydrate 嘢啊。咁仲有咧就如果係嘅話咧， 如果你過11嘅話，11啊，咁你已經係 confirm 係糖尿病啦。但係仲有，如果你呢樣嘢嘅話咧，你 glucose tolerance 之後咧，如果你過咗係呢個 fasting blood glucose 就7啦，嗱 A1C 過咗7.5咧，咁其實咧你都未叫做100% 係糖尿病，要做2次嘅。咁呢2次係6個月裏邊做2次。咁如果第2次後咧，咁你就真係糖尿病啦。OK，咁你就真係有糖尿病嘅 management。
So I know some of you will have interest to check the HIMSTIC, or we call it self-monitoring blood glucose (SMBG). So I put some guideline recommended by Royal College of Physicians London. They mentioned about who should be processed for SMBG. Basically, if you are newly diagnosed diabetes, or you have diabetes on insulin treatment, or you are put on oral agent with frequent hypoglycemia, or you will proceed for intense exercise or driving for a long time, or even though in the current illnesses, we will talk it a bit later during complication stage, and or pregnancy, or you have very alert on yourself, you will change your lifestyle and drug, then you may also need to have self-monitoring blood glucose.
OK， 嗱，其實咧呢個咧就有幾樣嘢咧，就係你知道，如果你首次去講你自己係糖尿病啦，即係開始係有糖尿病啦，咁你只要監控嘅。咁監控咧，第一就即係 check 下你自己係咪需要胰島素嘅treatment啦。咁當然好多時都未必係嘅。咁但係仲有一樣嘢，如果你係按藥嘅話咧，你就要睇下你食口服藥啦，會唔會即係講咧胰島素係太過低啦？咁變咗嚟講咧，你就會 end up 如果太低嘅時候，你就真係要好小心嘅。呢個 low sugar hypoglycemia就好危險嘅。咁同埋咧，仲有咧就要知道咧，我哋係要點能夠令到我哋係尤其是有運動啊、揸車啊，唔會暈咗佢啦。有陣時你係如果啲 sugar 太低嘅，你忽然間暈咗佢，咪撞車。咁你要保持自己啱仔。同埋仲有咧就係你記住啊，呢個係一個長遠病嚟嘅。咁你就真係要知道點去一個長遠嘅結果係點去 monitor 你自己，唔會繼續更加差。好重要咧，就係好多時咧，由懷孕期有糖尿病嘅人咧，你又要知道咧，呢個會真係變到真正永遠就係糖尿病。咁所以其實咧喺個糖嘅控制咧係一個好重要嘅東西，同埋仲有一樣咧，生活習慣啊、exercise 啊、食藥啊，呢個全部做晒之前咧，你都要自己 assess 呢樣嘢嘅，即係唔係淨係醫生 assess， 你都要自己 assess。
So there is a paper to show that if you are put on insulin, both either type 1 or type 2, if your SMBG self-monitoring blood glucose, it can evidence prove that it will effective in lowering your A1C, so it helps if you are put on insulin. While if you're not on insulin, just like on diet or on drug, then SMBG can also provide very useful feedback for you to control your own lifestyle and also empower your disease management by patient education.
OK， 咁嗱當然啦，糖尿病裏邊咧，如果你係 treat insulin 啦，咁你一定要繼續係 monitor A1C 啦，咁呢個係好重要嘅。咁如果 type 2 diabetes 咧 patient 咧，如果你唔係按 insulin 咧，咁亦都係要需要好多 feedback 知道係點樣。咁當然啦 patient 嘅教育啊，知道你點去管理係好重要嘅。可以寫翻自己繼續講佢話。
So this is the relationship between A1C and SMBG. I give you this a very interesting formula. So if some of you have checked the blood glucose, by all means, let's say picking the blood, and then you find out your self-monitoring blood glucose is already around 7, then you can estimate that your A1C is not that bad. It should be around 6. And while if you have already checking your fasting your HIMSTIC, your SMBG is around 9.4, then you know that your A1C is not very good. It's around 7.5. If it is even more double digits, then it's even more worse. And this is another figure to show from the American Diabetic Association, also tell you about both even in terms of SMBGs, minimal or milligram per deciliter, and then how to convert this into A1C for your long-term estimation. It's help patients make the connection between daily and long-term glycemic control. So can diabetes be prevented? So we have mentioned quite a lot before. Risk of type 2 diabetes can be reduced by losing your weight, regular exercise, walking for 30 minutes per day, and eating healthier food. less fat, burgers, fried chips, and more fiber, fruit, vegetable, and cut down alcohol consumption. 你翻頭前面嘅張，先去咗呢度嘅。
OK，
呢個就係
其實呢個圖咧係好緊要嘅。點解呢個圖好緊要咧？就因為咧你好多時都唔知你自己 A1C 係咩嚟嘅。咁其實咧好重要咧，就知道嗱好多時咧我度普通血糖咧就知道我係7度啊、8度啊、9度啊。咁但係點揾 A1C 咧？個 formula 好簡單嘅，就28.7乘呢個 A1C， 呢個 A1C 譬如6點，你撳住喺6.5啦，再減翻6.57，然後等於呢個數字就係呢個 average 啊。咁其實咧就你用翻個 formula 減翻轉頭咧，你就揾到 A1C 㗎啦。係啦。咁其實咧我哋都計咗成日都 estimate 呢個你自己 A1C 幾多。咁如果用翻呢個 formula 咧，就好容易做到 A1C 出嚟。咁如果有其他第時有問題咧，你可以再寫WhatsApp 俾我啦。咁我話教你點計，好唔好？因為你每日都睇到㗎。係啊，用翻呢個 milligram 去。嚇，最緊要咧就係 mg per deal 嗰個 number 嚟計啊，記住用呢個 number 計 OK 啦 ，OK。頭先講到呢個啦。OK， 嗱咁啊，仲有啦，咁仲有咧就喺個糖尿病第二個糖尿病風險裏邊咧，其實好重要咧，你真係要減磅啊！如果你唔減磅咧，你個磅咧一路計重咧，基本頭先講咗 slide 啊。如果再重過去咧，成日咧你更加你嘅 insulin 咧就好 resistant 嘅，有好多糖尿胰島素嘅抗拒。咁同埋仲有咧，就你如果每日行到30個 minute per day 咧，你亦都係降低咗你個胰島素嘅抗拒。同埋食嘅嘢好重要，一定要食健康啦，少肥啦，唔好食咁多 French fry 啊、burger 啲東西啦。咁你少啲脂肪，亦都唔會 damage 到個B cells 啦。咁變咗你個胰島素個 B cell 唔 damage，你個胰島素咪更加可以做得到啦。咁你 fruit 又得啦，即係fiber 啊，食啲橙啊、生果啊、蔬菜啊，全部咧幫助你咧係俾到你唔會多嘅所謂嘅白色嘅東西啦、白粉啦，多咗你個卡路里啦，同埋你嘅碳水化合物啦，咁亦都唔整嗰個糖膏啦，咁就變咗你亦都會身體更加健康啦。最後啦，如果你可能嘅 cut down 酒咧係好重要嘅，亦都呢個係加糖嘅。
So if you have diabetes, so what's the go-to management? Basically, you want it symptom-free, no symptom, and prevent any short-term complication. We'll come across it later. And prevent long-term complication, which is a dangerous thing, and even of you don't want to get it, and enjoy good quality of life.
嗱，其實咧，如果你話真係糖尿病點管理咧，最好咧就唔使有任何嘅症狀。嗱，呢個係第一個你重要。咁其實呢樣嘢咧係可以好一定係可以真係控制到嘅。呢個依家遲啲再講多啲，你就知道點解係咁啦。咁第二樣嘢咧，真係要能夠咧喺短暫裏邊咧冇其他好多嘅併發症咧可以減低或者淨唔愛咗佢。第三，如果長遠嘅併發症咧，亦都如果你係可以能夠預防咗佢咧，就一定會更加好嘅。最重要係最後咧，我哋都要有一個好嘅生活習慣，能夠咧令到你個生活更加質量好啦。咁呢樣嘢咧，陣間我會教晒你哋點去做呢樣嘢嘅。其實呢個全部達到好啊，因為我哋呢啲好多即係依家醫學常識咧，過咗之後，呢樣係做得到嘅。咁我相信你每一個人都係做到。
Good. So short-term complication of diabetes, it can be three things. Either it's too low, we call it hypoglycemia, or too high. Too high, there's two kinds. One is hyperosmolar hypoglycemic non-ketotic syndrome, or diabetic ketoacidosis. But this is relatively fancy medical term.
嗱其實咧最大問題咧就係最緊要咧，你唔會話成個血糖好低啊。當你血糖低嘅時候咧，咁你有好多其他嘅血病咧都會走出嚟嘅。咁同埋有啲就係有血即係變咗有血糖高啦。如果你血糖高咧，就會有 ketoacidosis 嗰啲咁嘅症狀啦。咁應該會再講嘅。
So first, hypoglycemia. Hypoglycemia basically is low blood glucose. While you have no blood glucose, basically most of the people will not have this unless you are put on insulin or you are put on a bit strong anti-diabetic drug or insulin secretion drug. Most of them is sulfonylurea, the diamicon, that sort of thing.
嗱，其實咧我哋好多時咧就點解會低糖咧？如果你低糖咧，多數嘅人咧都係因為打咗胰島素啦。另一個食一隻藥叫做sulfonylurea，好似叫做 glycoside 嗰啲咧， 佢就幫你泵多啲 insulin 出嚟嘅。咁呢個咧就一定會令到你胰島素降低嘅，要小心啊。
Yeah, especially when it will happen. If you put on insulin or you put on drug, and sometimes you just want to eat less or feel sickness and not feel comfortable and eat quite a little stuff. While you become more active, just walking more and or go to work, and by walking, then you will put yourself in the low blood glucose risk. And the symptoms and signs of low blood glucose can be as follows. It can be rapid heartbeat, sweating, pale, and sinus numbness, that sort of thing. For mild case of hypoglycemia, you can treat by drinking some sort of orange juice or eating a glucose tablet. While if this is very significant, then I think you better call ambulance because this is medical emergency.
OK 嗱，其實咧好重要咧，當你如果係好多人咧，你有個即刻 insulin 啦，或者剔緊呢個 glycoside 啦，或者收咗 urea 嘅嗰啲藥咧，咁你即係俾你個血糖咧會執得好低嘅。咁但係個問題咧，你仲呢個仲有執低嘅原因，仲有一樣嘢就係唔係淨係食藥啊，因為你運動啊或者做咗好多 activity 咧，令到更加低、更加快喎。當有呢個情況嘅時候，或者你 worry 都會有嘅啊，其實啊，遲咗食嘢都會有嘅。咁多數咧，你個 sign symptom 咧就會心跳快啊、出冷汗啊、皮膚蒼白啊、忽然間好似好驚啊，仲有咧你啲手腳即刻麻痹咗啊，好眼瞓啊、精神唔夠啊、仲有錯亂啊、頭痛啊，同埋咧想講又講唔到啊。嗱，依啲嘢嘅時候咧，你好重要咧就即刻食啲糖或者飲咗 orange juice，有糖餅啊啲咁嘅嘢啊，即係要令到你咁，所以講叫我哋嘅糖友咧，個個都要帶粒糖餅就係醫解嘅。咁但係如果你真係好唔掂咧，就要叫十字車，因為呢個係有好大嘅 risk 喺度嘅。
So this is low glucose. Well, high glucose can be two things. One is hyperosmolar hyperglycemic non-ketotic syndrome, HHNS. Why you have this? Most of them occurs when you feel sick or you are elderly. When you feel sick, your body's stress hormone will increase to fight the illnesses. This hormone will also raise your blood glucose. Your body will try to get rid of the excess glucose through frequent urination. Well, because that's dehydrate your body, and ultimately you will feel thirsty. Unfortunately, when you're sick, you always lie on the couch or lie in the bed, and unfortunately you can't rehydrate your body. So with that sort of vicious cycle, you can't rehydrate your body, and blood glucose continues to raise up, and ultimately you go into a very high state in coma. This is a very sad, and because of you feel sick. And to avoid hyperosmolar coma, then you keep to watch your blood glucose. So you already check, especially when you're sick. Okay, just few slides before we talk about the raw crisis, the physician mentioned that we will feel intercurrent sicknesses. You need to check your blood glucose. That is all mean. And so also you have know what is sick day pain. When you feel sick, when you see the doctor. And HHNS by all means is a very medical emergency because you feel coma, so you need to seek help.
Okay.
This cannot help by yourself.
嗱，如果你係即係有個高糖嘅併發症啦，咁其實多數係依個情況係點樣出現嘅咧？好多時咧就係因為咧你係譬如係病啊，咁你病嘅時候咧個 body 咧就要出多啲糖咧俾你 ready to fight， 即係 fight and fight 啊，你明唔明？咁但係多糖出嚟嘅時候咧，你已經病啦，唔係好舒服啊，你又唔喐喎，又唔飲水喎，啜水喎。嗰啲糖馭值高咧嘅時候咧，咁嗰啲糖咧可以令到你咧真係會能夠暈咗嘅。咁好多時咧依個嘢嘅時候，因為你度咗糖就係知道有個情況。如果度唔到咧，你走開啲暈嘅時候咧，你就真係要十字車嘅。咁所以變咗嚟講咧，依個咧係當你有大病嘅時候，你已經糖友啦，你就一定要有個計劃性嘅東西準備你自己。如果真係啲糖分有燒到高咧，我點做咧？依個你一定要有個計劃嘅。
And the other is diabetic ketoacidosis. Most of them is type 1 diabetes. So type 2 is relatively less. It's because the insulin in the body is so low and cannot get the glucose back into the cell, while your body, because no glucose into the cell, burn up the fats from the store and ultimately produce quite a lot of ketone in the body, and this is acidic. It's come out to be diabetic ketoacidosis. And the trigger factor is because of infection, not taking insulin correctly, or some people may have some sort of secondary to heart attack or stroke, or even some people put on steroid by yourself. And symptom of diabetic ketoacidosis is the other sides of hypoglycemia. Because you are high glucose, so you frequent urination, extreme thirsty, high blood glucose by checking, and high level of ketone in urine. And also some people have also a confusion, first smelling, fruity smell, breath, and also fatigue. And DKA definitely is a medical emergency, and you need to call ambulance.
嗱，呢個咧第一咧，多數係 Type 1 diabetic 嘅人先有嘅，因為呢個咧keto 即係呢個 ketoacidosis 咧，就係當你係好即係 Type 1嘅人咧，當佢係好多糖出咗嚟，但係咧佢個糖咧又會喺個血嗰度講，唔係佢喺嗰個 insulin 個 body 咧係會冇 insulin， 但係咧佢好多糖走咗出嚟，咁佢就個 body 嗰度咧就會
身體啲 cell 冇用 body 冇 glucose 就用多啲 fat 咯。
係啊，如果因為佢係啦，一個 body 冇咗嗰個糖咧，咁佢就出咗啲由脂肪度攞啲糖出嚟啊，咁佢變咗就 acidotic 嘅，咁 end up 咧就會係 end up 好多時咧就你會有呢個不同嘅反應咧，有一個好重要反應嘅時候咧，就係有個 fruity smell 啊。即係個口嗰度咧，好似有啲糖好甜嘅 smell 出嚟。咁呢個係 commonly 咧都有呢個情況出現嘅。
So this is a very simple slide to show the hypoglycemia symptom and hyperglycemia. So we have talked about this. If you are hypoglycemic, you will have sweating, pallor, and irritability, less of coordination. While hyperglycemia, both diabetic ketoacidosis or HNS, you will feel dry mouth, thirsty, weaknesses, blurry and frequent urination.
OK， 嗱兩個症狀啦，第一個咧就低糖嘅症狀啦。嗱低糖啊，好多人都有嘅，即係出汗啦、出冷汗啊、蒼白啊、肚餓啊、暈暈地啊，同埋就好想睡覺啊，同埋咧就即係有陣時都即係亂咗龍啊。但係當你 high 糖嘅時候咧，即係高糖嘅時候咧，多數咧就口乾啦，就繼續飲嘢都唔即係好似飲唔夠水咁啦，好頭痛啦，同埋好弱啦個人。視覺有夢啦，同埋咧就成日去廁所嘅，呢個兩個係即係重要嘅即係 symptom 都會睇得出嚟嘅。
So we will talk a bit about sick-day pain and management, general advice for you to avoid short-term complications to develop. When you call doctor and write down in your pen, and also drink if you feel sick, okay, and also drink extra calorie-free liquid or try to eat as normal as you can, and continue taking insulin or diabetic pill as usual to avoid too high diabetes. Test your blood sugar every 4 hours, or if you cannot every 4 hours, then maybe before meal or after meal. Weight yourself to avoid any loss of body weight, and this is maybe a sign of too high or too low glucose. Check your temperature, especially any fever. And when you need to check any urine keto, if it is available for you, okay? So
嗱，咁其實咧好重要咧，就係好多時咧，當你病嘅時候，尤其是病啊，你又真係有個短暫嘅病嘅去知道點。如果我病啊，咁我係個糖尿病病者，我應該做啲咩喺24小時裏邊？第一，你一定有醫生嘅電話喺度啦，或者十字車電話啦。咁其實你要飲夠水啊！呢個水就唔係有好多有少少卡路里嘅水啦，但係唔係一定要，即係唔係有好多卡路里嘅水，應該係卡路里 free 嘅水，即係少卡路里嘅水。但係你要 eat 咧，就要食得啲係即係有個 balance 啲嘅食物啦，同埋仲有咧，如果你係食緊糖尿病或者你糖尿病嘅藥或者打 insulin，你繼續打啦。咁但係好重要咧，點一樣嘢好重要，好多人都唔記得咗，繼續 test 你個 blood sugar。朝頭早 test， 食完嘢佢又 test， 咁你知道你嘅糖成日喺邊度啦？仲要咧磅下你自己啦。同埋咧，仲要 check 下你自己係咪有發燒啊嗰啲咁嘅體温啦。同埋咧，就如果你有 ketones 啦，即係其實 keto 好容易做到咧，就聞到個 breath 啊，係有個 fruit taste 嘅味道嘅，即係有生果好似味道咁嘅。咁所以變咗嚟講，如果有呢啲嘢咧，咁你就可以計劃到，即係唔會俾你自己暈咗啦，因為好多時因為有高有低嘅。
So we have covered about short-term complication. While for long-term complication, it is well known. Diabetes increased risk of heart problems, stroke, eyes, kidney problem, and foot problem. 嗱，其實咧有一個好重要咧，就係好多時咧有我哋嘅病人咧就知道原來我哋嘅最大風險喺邊度咧？如果糖尿病嘅風險啊，第一就係個心臟嘅問題啦、中風問題啦、視力嘅問題啦，同埋我哋嘅腎病嘅問題啦，仲有腳嘅問題。Why this is? Because hyperglycemia can cause a very severe long-term problem. This can be either we call it macrovascular complication or microvascular complication. macrovascular complication basically is just like a big blood vessel diseases. This can be heart disease, heart attack, stroke for the brain, and also the peripheral vascular diseases for the limb. While the small vessel problems can be retinopathy, the eye, the nephropathy, the kidney, and also the neuropathy, the nerve.
嗱，其實咧，如果你成日都係高糖啦，即係 hyperglycemia 即係高糖啦，其實咧記住啊，糖尿病係全身體嘅 vessel 都有 affect 嘅，有大同細嘅。大 vessel 咧就係即係大嘅血管咧就係心臟血管啦，你會話有 stroke 啦，即係有中風啦 ，heart attack 啦，同埋咧你手腳咧即係都嗰個血液循環唔正仔啦。咁但係如果細嘅血管就係令到你眼盲啦，或者你個腎嘅影響你個腎嘅問題啦。咁同埋仲有咧就係你嗰啲神經系統係有damage 嘅咁最後啦，如果啲糖係仲更加差咧，令到血管隻腳嗰度咧係傷害咗之後咧唔好咧，咁你腳都會斬埋。
So this can be just a simple slide to recap about the diabetes causing the heart attack, stroke, and amputation, as well as the limb problem, kidney and eye problem.
嗱，呢張圖咧亦都再講多次啦，就係你會happen 你嘅腎啦、中風啦、心臟啦、眼啦，同埋所有嘅神經咧，令到腳咧即係會發炎啊！如果發炎搞唔好咧，就驚要割咗個腳啊！咁其實都好痛苦啊！
So this is another, I think, is very important slide, but it's very medical field. It's message from randomized controlled trial. That means this is from scientific paper and it's evidence-based. From the well-known UK PDS study from UK, Advanced RCORD and DCCD from America. What is the evidence and scientific paper tell us? Is high HbA1c, high glycosamine hemoglobin, associated with microvascular and macrovascular complication. And remember, reduce heavy 1% of A1C lower. You will lower your complication risk by 20 to 30%. That is what we are talking about. And benefit maintain long term, just not short term, it's long lasting. And metformin, we'll touch it a bit later, is superior to other drugs. And there is very important message I highlight in red because we encounter many patients in our daily practice. Many patients a bit hesitate to start on drug at early stage. But unfortunately, if you are being diagnosed of diabetes and your control A1C is not well controlled, we strongly advise to put on start medication as early as possible because it's important. This is the finding from the UK PDS study. Later on, the next slide will tell you.
Okay.
It's called legacy effect.
OK， 嗱好重要啦，呢個 slide 係好重要嘅。點解咧？其實咧喺個 A1C 嗰度咧，知道咧，如果你係真係成日高，同埋你個細嘅血管同埋大血管咧，都會 affect 到噶嘛。咁喺 A1C 嗰度咧，如果你係 lower 你嘅 A1C 1% 咁啫，其實咧就降低咗你咧個風險咧係20至30%，哇，好大喎！呢個降低係成個身體嘅風險喎。咁其實仲有一樣嘢，如果你 A1C 已經係即係去咗過7啦，咁其實好重要就開始食你呢個叫 metformin 呢個藥，因為呢個藥咧能夠令到一個好早啲嘅東西咧能夠控制血糖咧，令到血糖降低咧，咁你個 A1C 亦都降低咧，係令到你一個係風險啊少咗20%至30%嘅。
Yeah. So remember, this is every 1% A1C benefits you, even though we target is less than 7 or less than 6.5. But unfortunately, some people may have around 9. But even they are 9 and then down to 8, then it's already down 1%, and you will benefit from the reduction of A1C.
嗱，其實好簡單，如果你個 A1C 係9，你跌到8，即係1% 㗎喎，嗰度已經去咗，咁你就變咗咧8至即係1% 係 A1C 喎。因為9你8去跌到8 1%，咁已經係減20%啦，咁20至30% 嘅 risk 喎，咁呢個係一個好重要東西嘅。嗱，記住咧 A1C in percentage 㗎，記住你度血糖嗰就即係度數 millimole 或者 m milligram per deal，OK？ 咁 A1C by percent。Remember A1C is by percentage. Sugar in Hong Kong is millimole per liter, US milligram per deal. So this is low. If your A1C is 9% minus the 1% is become 8, you actually decrease 20-30% of your risk.
And remember, we have talked about legacy effect. 中文叫做饋贈嘅。
OK.
This is why it is important because you start treatment as early time, even though at later stage your diabetes cannot be well controlled, then the benefits will long lasting. This is called legacy effect. And this is echo to the second point. Glycemic control deteriorate over time. In the previous slide, we have showed that with time, your diabetes will get worse. So for people with long-term diabetes, unfortunately, we want you to have a better diet control and also by all means reduce the A1C. But somehow may not be under well control and then they need to put insulin because glycemic control deteriorates over time. And also it's found that intensive glycemic control in long-standing diabetes with multi-morbidity, no benefits. So we can be more lenient towards the long-lasting diabetes with comorbidity. And not just the A1C, the blood pressure, lipids, and also use some guardian drug, the ACI, ARB to protect the kidney, smoking cessation, weight control, also very, very important and comprehensive management for diabetes.
OK， 嗱，記住咧，仲有另外一個 point 啦，記唔記得嗰個 graph 好緊要咧？一路上去嘅時候咧，嗰個糖尿病咧個 graph 咧，然後即刻就低咗落去啦，咁 insulin 又唔出嚟啦，唔泵出嚟啦，有煙有都冇用啦。咁呢個就係同樣嘅問題啦。當你成日都係血糖高控制唔到咧，咁其實咧個問題越整越大嘅。咁同埋仲有一樣咧，呢個咧就係呢個點解釋呢度 ？sorry，
如果糖尿病越嚟越耐，好長期糖尿病，或者你本身好多併發症嘅咧，就算你控制個糖尿控制得好緊咧，其實唔好意思啦，都唔係太大幫助嘅。
OK， 咁呢個啦，仲有如果你係血壓又高，你膽固醇又高，又要食煙嘅，又冇 weight control 嘅，呢啲全部會令到你糖尿病會失控。OK。
So this is the UK-PDS study tell us. UK-PDS study is very famous. First published in Lancet, 1998, 刺針嚇。And they show that with intervention group where the general control group, the relative risk reduction for diabetic endpoint, microvascular condition, MI, and all-cause mortality decreased about 25% for the complication. And UK-PDS study used the landmark A1C control less than 7. While there is another interesting thing, they have a long-term 10-year observation follow-up and published in 2008 in New England Journal of Medicine. They find out to review this group of patients. After 10 years, both control group and intervention group, both diabetes control is worsened. They will come to the endpoint that their glucose and A1C is not well controlled. While the people who have early been treated for diabetes by all means by metformin, their relative risk complications still better than those not treated.
OK， 嗱，其實點解要好早去 treat metformin 咧？呢個圖咧解釋到咧就係，當你10年後你個 metformin 咧，如果繼續 treat 咗之後咧，如果你唔係早 treat 咧，其實你個失控同埋嗰個藥嘅效用咧都唔係好高嘅。但係如果你10年後真係可能夠繼續 treat 咗之後啦，咁你而家10年後裏邊咧，其實你嗰個糖尿病嘅壞咧係低咗嘅。其實呢個就即係可以唔會繼續壞落去，減少併發症，減少咗你嘅併發症嘅。咁就係呢個，所以變咗嚟講咧，即係希望就係早啲食咗呢個metformin先嘅。
So that means even though when you have seen your doctor, you follow up your general practitioner or GP, and then they advocate you to put on drug in early phase, then sometimes may not be hesitate, just agree on it. This is a very important slide. And this is the summary of the various clinical trial from what we have talked about, that all show that this will benefit and increase the risk of microvascular complication, and this is long-term complication. And while the landmark UK-PDS study show there is a long-term follow-up, find out that both the cardiovascular risk and microvascular risk as well as mortality also reduce.
OK， 如果早啲食藥咧，第一你所有嘅大血管、細血管咧都能夠冇呢個差啲嘅併發症啦，同埋仲有一樣咧，心臟又少咗啦。第三咧就係唔會咁多人死嘅。呢個係英國 study 嘅，
係。This is a basically you summarize what we are talking about, and in Chinese and in figure, just every 1% of A1C reduction can reduce 21% of all-cause mortality, 14% of myocardial infarction, 12% on stroke, 43% of peripheral vascular disease or amputation, 37% of nephropathy, and 19% of cataracts or retinopathy.
嗱，其實咧喺呢個 slide 好特別啊。其實降低1% 係 A1C， 即係話如果 A1C 係9啦，咁然後減到8啦，咁已經咧係能夠減低21% 咧係死亡啦。第二個心臟病發作啦，中風12% 啦。你割咗個腳啦，即係話有個 gangrene 啊嗰啲就減低43% 啦。腎病發作31% 啦，就仲有白內障同埋或者呢個其他嘅眼嘅問題咧19%，所以 A1C 係好重要嘅，減低 A1C。
So we talk quite a lot of A1C. So how to manage your diabetes? So basically, it can be diet, exercise, and also drug.
嗱，其實咧仲有一個啦，就點能夠減低你個糖尿病嘅問題啦，就係食物啦，仲有一個咧係叫做exercise 運動啦，仲係要食藥啦。
So for the diet, we talk about the appropriate amount of carbohydrate and improve the glucose control as well as the food choices.
咁其實 diet 好重要咧，就係減低糖嘅食嘅東西咧，即係減低 carbs 啊，減低嗰個所謂叫做碳水化合物啦，同埋要一個 smart choice 嘅食物啊，即係好嘅選擇食物。
So basically, I think some of you may heard or may not know. The focus is called glycemic index, the low GI index. Basically, what is GI index, glycemic index? It's measure of the carbohydrate content food, how slowly or how quickly they are digested and increase your blood glucose. If it is high GI value, faster to increase the blood glucose. If it is lower GI value, slower to increase blood glucose. So if you will be more smart, then you need to choose the low GI value food.
嗱，其實咧食物裏邊咧有一個叫做glycemic index， 即係食物升糖指數啦嚇。咁如果食物嘅時候 high 升糖指數，即係 high food 嘅升糖指數 high glycemic index 咧，好似飯啊就93好高嘅，咁呢個就唔正仔嘅。但你揀嘅食物咧就應該係食低嘅即係所謂叫高糖指數，要食低嘅。咁變咗嚟講，佢哋糖咧唔好快嘣一聲就升咗上去好高嘅喺血糖裏邊啊。
So this is quite a lot of people like to go to restaurant for dim sum, and this is Coke and food drink, and also the biscuits, bread. This is all high carbohydrate, high food, and this is we teach although this is in Chinese, but basically we use this in our daily practice about what is high carbohydrate, high GI index food. The red one is high GI index, the yellow one is middle GI index, and the green one is a low GI index food. Basically, although it's in Chinese, but basically the picture can tell you what is the food content. Just Andrew talk about the rice, congee, noodle, pasta, biscuits, bread, and this kind of thing is high GI food. If you take quite a lot of that thing, your blood glucose will like this one, shoot up within 1 hour and then drop, and then you feel very hungry. Some people like to take, in Chinese, quite a lot of them like to eat congee. But we experience that if you take congee very frequently, you will feel very thirsty, hungry, and then you want to take more. That is high GI food because they absorb very fast and then decrease the blood glucose quite fast, and you always want to eat some more. Some other food is also being in the high GI foods, such as watermelon, durian, mango, longan lychee, and that sort of thing. While if you would like to choose the more smart and low GI food, green bean and vegetable, always a good thing, vegetable. And also some lean meat, and also some sort of carbohydrate, also some is good, spaghetti or macaroni. And for the food itself, some apple, dragon fruit, kiwi, and pear is also low GI food. So if you want to smart choices of food, choose the low GI food. And most of the time, if you want to be more healthy, then your food content should be every 2 portions of vegetable, every meal, 2 portions of vegetable, 1 portion of carbohydrate, and 1 portion of protein. This is relatively good for your diabetes. Although I think most of you know that, but it's always easy to talk than word. During the clinical encounter, most of patients know that, but in daily workout, they hard to do it because in Chinese, many people like to yum cha and causing quite a lot of problems.
嗱，其實咧，我哋做糖友咧，好重要啦，就唔好食咁多呢個 high 高升降食物，即係 high glycemic index 同埋 high carbs 應該 high glycemic index 啱呢個寫咗。咁其實咧就好似飯啊、麵包啊，呢啲全部 high glycemic index 嘅蛋撻你咁，因為食咗之後咧，睇到咧個血糖咧嘣一聲升咗上去嘅，低嘅咧就慢慢升上去，咁就變咗唔係咁 affect 你自己咯。咁其實咧其他咧就黃色嗰啲咧就係中性嘅high glycemic index 嘅食物中性嘅嚇。咁其實最好就揀擇啲係低升糖嘅食物，好似通心粉啊、意大利粉啊，同埋食翻多啲綠色嘅菜蔬啊、蘋果啊、呢啲咧，同埋仲有豆類啊，呢啲咁樣同埋 cucumber 呢啲全部咧都係可能夠係叫 low 低嘅glycemic index 嘅食物。咁當然啦，每日咧其實我哋應該食兩份嘅菜蔬啦，一份嘅 carbs 啦，一份嘅 protein。咁嚟講咧就 balance 翻落全物嘅食物嘅。
So and also diet high in vegetable and food also not just good for the diabetes, such as Mediterranean diets. Quite a lot of people talk about this topic. Basically, it's also reduce your cardiovascular risk.
嗱，其實呢個好好嘅，因為好多人咧就講及呢個叫做地中海嘅食物啦，同埋呢個咧就幫助咧令到血管咧就唔會有咁大嘅個心臟嘅 risk 喺度嘅。咁所以呢個咧係希望你食嘅嘢咧都係用呢個地中海飲食嘅習慣嘅東西咧係會對你十分好嘅。
Yeah, so it's simple that if you take more vegetable and food, it's not just good for your diabetes, also good for your heart.
其實咧就好簡單啦，食呢樣嘢啦，地中海裏邊咧就係有咩咧就食多啲生果啦、fruits 啦，即係呢啲咁嘅菜蔬好似 kiwi 啊嗰啲咁啦，食多魚啦嚇，咁就會對你十分有幫助嘅。
So there's no single definition what is Mediterranean diet. It's very broad, but by all means, it's mean that is the food content with more food, vegetable, whole grain, beans, nuts, and seeds. While also use the olive oil as its main source of oil component, low to moderate amounts of wine drinking, and also taking the lean meat. Okay, and systematic review and meta-analysis finds out that the Mediterranean diet not just reduce the overall mortality and cardiovascular mortality, also benefits for cancer, as well as Parkinson's disease and Alzheimer's disease.
OK， 嗱，其實咧地中海嘅食物咧，其實唔係一定有好好定義嘅，但係最重要咧就知道咧，原來佢裏邊咧係少啲嘅唔係好甜嘅水果啦，多啲生菜啦，多啲豆類啦，同埋好多係nuts 即係nuts 啊，同埋佢用嘅嘢咧係用橄欖油啦，咁啊唔好咁肥啦，同埋咧就係好少糖嘅好低糖嘅葡萄仔啦，仲有咧食好少嘅肉啦，同埋食唔係肥嘅肉嘅應該，同埋食魚啦，同埋多數食啲即係同埋啲奶類啦，同埋肉咧即係少嘅紅肉啦。仲有好特別咧，食咗呢個之後咧，原來咧佢減低咗唔淨止佢心臟嘅問題，仲有減低 cancer 嘅問題，亦都減咗低咧就有白金遜嘅同埋 Alzheimer 嘅 disease。咁呢個都好特別喎嚇。
So after the diet, we take a bit no exercise. So can exercise help reduce glucose? Definitely. It will improve the glucose tolerance, improve the body glucose utilization, and increase the insulin sensitivity. We talk quite a lot of decreased insulin sensitivity, impairs the insulin resistance. But exercise definitely will increase the insulin sensitivity and reduce the insulin amount needed. And there is a study that shows that if you can do exercise 60 minutes, aerobic exercise, then you can reduce your insulin resistance up to 48 hours. That is very simple. Even though you cannot do exercise every day, but you can do it on alternate days. Then after the 60-minute exercise, your improve your insulin resistance can last for two days.
OK， 嗱呢個好特別啊，因為點解咧？好多人都唔知道原來做運動咁緊要嘅，因為近度咧能夠令到幫助你降低你個血糖啦，第一。第二仲有一樣係降低咩啊？降低你個胰島素嘅敏感性啊，即係冇個胰島素 resistance。原來佢呢個做嘅方式咧係會有2日嘅效果嘅。如果你每日做一個60分鐘嘅exercise 咧，呢個 last 咗48個鐘頭咧係能夠令到下一次嘅胰島素嘅抵抗咧都仍然有效嘅。 咁所以變咗嚟講咧，就算你話一日唔做 exercise， 第二日再做 exercise， 再隔多一日唔做 exercise， 再都有效，所以繼續係做 exercise 啦，記住。
So a person, if not just blood glucose, if you want to lose weight, we talk about obesity. So if you want to lose weight, there is very simple calculation. You need to lose 3,500 more calories than consumed to lose 1 pound per week. How is this converted into the schematic diagram? Just like walking, if you walk a bit faster every day, let's say it's a 70 kilogram person. I think Andrew is around 7 kilogram.
Well, 90.
Yeah. Similar, 7 kilogram person. Then if you walk a bit an hour per hour every day, around a bit faster, you can lose around 460 calories. So if you do it every day, doing more walking, so you just times 7, then it's around 3,500.
Okay.
And you can either doing walking or jogging, running.
Okay.
Running even a bit more.
Okay.
And you can also do it a bit different. If you are thinner, you can the calorie burns per hour will be higher for person who weigh more than 70 kilograms and lower for person who weigh less.
嗱，其實咧最日咧好重要咧就係你一定要繼續減磅啦。咁如果減磅咧，你想即係減1磅啦 ，for example 啊，咁我每日都係食3500個卡路里嘅。咁如果呢個做咗一樣嘢，咁其實咧要行1個鐘頭咧，你每1個鐘頭咧你就 burn 咗460個卡路里。咁其實咧，如果你每日都係咁做咧，咁你每日就每日都乘呢個數字乘7啦，咁你就其實7日後咧你都減咗即係1磅嘅。減咗1磅嘅卡路里㗎。
So this is a simple, this is a simple calculation for every one of you because many people tell us how to lose weight. They don't have the very clear cut of picture. So this is evidence show that if you want to lose 1 pound every week, you need to spend a bit 3,500 more calories. Okay, by all means. Okay.
Okay.
If you can run, you can do other exercise. Even swimming is okay.
Okay.
But simple is walking and running is very good.
OK 嗱，其實咧，如果即係因為最近呢個俾個 formula 你咧，如果你想減1磅，你係要減咗3500卡路里嘅。咁其實係1個禮拜啦裏邊啦。咁點做咧？就每日行460每日行4.5個 miles per hour 嘅1個鐘頭。咁你就要減460個 calorie， 咁你就再乘7啦，咁你就啱啱係有3500個卡路里減到啦。
So you need to do more exercise to lose the weight, okay?
Yeah， 咁你真係要做好多 exercise 啦嚇，嘅減磅啦嚇。
So for some of you may not afford to do exercise every day. So there is another thing called high intensity interval training, HIIT. So what does this mean? HIIT versus moderate intensity continuous training, which is what we're talking about. Every day walking for 7 days. This is moderate intensity continuous training. High intensity interval training is also benefits. It can improve your insulin sensitivity and also improve your blood pressure and also greater reduction in your total fat. There is a meta-analysis around 39 studies find that HIIT, particularly running, jogging, is very time efficient and also burn your fat. Some people may just doing alternate exercise, not every day, but just alternate day exercise by high HIIT is good.
OK， 咁其實咧，如果仲有一樣嘢咧，就唔淨止行啦，如果行咧，仲可能夠降低咗你個 insulin 嘅 sensitivity， 即係 insulin 唔會抗拒啦，又降低你個 blood pressure 啦，又降低咗你血壓啦，同埋你可能夠你個肥嘅脂肪又降低啦，咁其實好重要嘅。咁其實呢樣嘢咧，你就一定要更加係做到呢啲即係exercise 嚟解決你個高度嘅 exercise 咧，能夠令到你更加係將你嘅重磅係降低嘅。
So this is a recap and not just good for the diabetes. Even though if you can just brisk walking for 20 minutes, at least 20 minutes per day, it's also benefits for your heart.
其實咧唔淨係糖尿病咧，如果你係普通人咧，你每日行多20分鐘咧，亦都會多幫你係你個心臟亦都會有幫助嘅。
So this is figures tell you what is moderate intensive exercise and what is rigorous intensive exercise. And rigorous that means burn more energy, while moderate burn less energy.
其實咧左邊嗰個咧就係嗰啲 exercise 咧係唔係咁劇烈，但係都可以 burn 到嘢burn 到你個calorie 嗰啲咁嘅。右手邊咧就劇烈啲嘅，譬如 running 即係快走啊。咁左邊嗰啲咧 dancing 同埋即係行咁都係兩樣都有嘅，一個中性一個強烈性嘅。
Yeah, even some housewives may tell us that they do not have time to do exercise, but at least you do some gardening or some housework, and while just basically sedentary lifestyle, just sitting, if you don't sit, go to do more housework and gardening, then it's also benefits for you.
嗱，其實好多即係家庭主婦啦，我冇時間做 exercise 喎，咁點做咧？其實如果你繼續做 housework， 即係掃地屋企或者做家務再做埋呢個花園嘅做種植嘅東西，亦都係幫到你嘅。
So the cornerstone of management of diabetes is physical activity, diet, and drug by insulin or by oral medication.
咁其實咧喺糖尿病嘅管理咧個基礎裏邊咧係3樣嘢嘅。第一就係有一個做 exercise 啦，活動其他東西啦。第食嘅東西啦。第3咧就係胰島素同埋或者係糖藥嘅東西，幫助3樣嘢咧都幫助你控制你嘅糖尿病嘅。
Okay, so we talk a bit about the diabetic drug to introduce. Basically, it's more simple. Just either the drug is lower the blood glucose hypoglycemic drug or long hypoglycemic drug. Insulin definitely is hypoglycemic drug. Sulfonylurea is also hypoglycemic drug. While long hypoglycemic drugs can be biguanide, which is metformin, and there's various other kinds of coming new drugs, glucagon, DPP4 inhibitor, GLP-1, and SGLT2 inhibitor. This is more latest drug.
嗱，其實兩種呢個藥物嘅，第一種藥即係如果降糖尿病嘅控制藥物，第一個咧就係將個糖降得好快嘅，咁呢個就係胰島素啦。第二個咧就係叫sulfonylurea，即係好似叫 glucose 嗰啲咁嘅藥啦，係將個胰島素係即係將個糖降到好多，佢或者泵多胰島素俾你，咁然後你降低嘅糖 ，OK， 呢個就叫將，但係呢個效果咧就有個問題咧，就將你個糖降得好快好低。另外一個咧唔係將糖降得好快好低咧，就係有個藥物咧就叫metformin 啦。咁你成日聽到有 metformin， 聽過第一個多數有 metformin， 但係新嘅藥物咧現在咧就係SGLT2。咁呢個咧幫助咧唔淨止係唔會令到你糖好低，但係亦都幫助腎咁，亦都遲啲要再講俾你聽嘅。
Yeah, SGLT2, yeah. So there is various factors that can affect causing hypoglycemia, and different drugs act on different pathways, such as sulfonylurea insulin acts on pancreas to decrease the insulin, to improve the insulin secretion. This is because the problem. And the metformin, we talk quite a lot of them, is to decrease the hepatic glucose production. Some sort of glucagon is to increase the glucose uptake. And the SGLT2, the new drug, is try to increase the glucose excretion from the kidney and to lower, and using another pathway to lower the blood glucose. It's also mentioned that the new drug is also protected the heart and also protected the kidney, reduce the heart failure as well as the renal impairment, and also good for the blood pressure and weight control.
嗱，可以講翻啦，就係如果你講話好似 SU 啦，就glycoside 嗰啲咁嘅藥啦，咁就將佢咧就可以俾好多胰島素出嚟，然後咧就將佢降低血糖，咁令到你咧就係因為你唔夠胰島素啊嘛，咁個血糖咧就佢俾啲胰島素出嚟，咁然後你咪整個血糖更加低咯。咁另一個咧就係metformin 啦 ，metformin 咧就用個肝臟咧係去增加你個胰島呢度點咩 ？sorry， 呢個肝臟嘅。
metformin 佢幫助個肝臟咧吸收咗啲血糖。係
肝臟嗰啲血糖 ，OK 冇錯，肝臟嗰啲血糖。咁然後咧就SGLT2 咧就係佢係幫你排走啲胰島排走血糖尿。咁咧但係好處咧就係能夠令到咧嗰個護心護腎嘅。
SGLT2 is relatively new drug, and is talking quite a lot over the media, as well as the new guideline is also talking about this drug, while the SGLT and metformin is more traditional drug. And we will cover a bit about metformin. Basically, this first-line core therapy, definitely it will reduce cardiovascular risk. The advantage of metformin is if you take metformin, you will lose your body weight. So if you're obese, that's good news. And relatively lower risk of hypoglycemia. Although this seems to be good drug, and another thing is this is relatively cheap, okay? But it's also some problem. If you are renal impaired, then you can either lower doses or need to stop the drug. Or many patients, after taking the metformin, they will have some sort of gastrointestinal upset, dyspepsia or diarrhea.
OK 嗱，metformin咧可以講係即係最 basic 第一 line of drugs 咁，大多人都會用呢樣嘢開始先嘅，個個都會㗎。咁但係好可惜咧，就佢其實都唔會話令到血糖好低嘅，所以冇一個低血糖嘅低風險嘅。咁但係有一樣嘢咧，佢就會係令到咧就係佢可能令到你會有些少其他嘅併發症，
胃嗰度
係胃覺得係會肚瀉啊嗰啲咁嘅併發症嘅，其他就冇乜嘢其他問題嘅。
腎功能好差嘅時候都唔用得。
但係如果腎功能好差都唔用得嘅，冇錯。
Another drug is sulfonylurea. Sulfonylurea is a very traditional drug. It's also good because it's cheap and it's very potent. You can lower the blood glucose and A1C very good. But this is insulin secretor. So in long term, people may get worse with the put on sulfonylurea. And also high risk of hypoglycemia, especially the long-acting one. This is Daniel. And especially very high risk for people elderly and also renal impaired. While the shorter acting 1 minute diet is relatively safe for elderly and renal impaired.
OK， 嗱呢個咧 sulfonylurea 咧就係你好多我哋政府嘅都睇到一個 glycoside 嗰啲個藥啦。咁但係有兩種嘅，第一個咧就係 fast acting 嘅，咁但係呢個咧就會係如果繼續用咧，可能會令到即係嗰個腎有問題嘅，但係佢就 act 得好快，即係能夠降低血糖好快。咁第二樣嘢咧就係呢個係俾老人家係即係短暫啲嘅，就叫做 minute diet 咁就呢個咧就係會即係俾老人家更加 safe 啲啦嚇。OK。
So insulin we will skip it. Basically, there's very many different kind of insulin, either short acting or long acting.
咁 insulin 咧，我哋今次唔講咁多啦，其實就有 short 同 long acting 嘅啫，係短暫。
So for ABC of drug selection of diabetes, you can be either in terms of age, BMI, complication and cause, duration, expectation, family, that sort of thing. So choices of different kind of drug for the diabetes.
嗱，其實喺藥揀嘅時候咧，最緊要歲數係點啦 ，A1C 幾多啦，你係重磅嘅 BMI 幾多啦，有冇其他 complication 啦，同埋你仲有食咩嘅食物啦、diet 啦，同埋仲有冇其他嘅即係你生活習慣係點啦，同埋你本身嘅環境係點啦，同埋你錢係咪夠唔夠啊？啲咁嘅嘢，同埋你仲有食藥食物有冇 smoking 啲全部都會用個 consideration 食咩藥嘅。
So just final slide. Structural team care and patient-centered approach from diabetes management. Structural team care basically is nowadays people talking about the team approach to manage diabetes, not just by doctor alone. We have multidiscipline, dietitian, DM nurse, ophthalmologist, and physiotherapy for weight reduction. And also, just like Andrew, you have a group who already have reminded to tell you how to improve and invite different kinds of professionals like us to teach you about the diabetes to control. So the evidence tells us that structural team care is good for the diabetes control. It's much better than drug alone.
OK 咧我哋亦都睇到咧，其實現在嚟講唔係就係醫生睇你，應該係團體嚟睇你。裏邊有即係我哋啲咁嘅人士啦，可以講咩叫病理同埋因為醫生未必有咁多時間同你講。咁亦都可能夠整到多啲人咧，亦都有個 dietitian 嚟幫你手了解鼓勵你，因為最重要嘅知道咧就係糖尿病係一個長遠意思嘅，唔係一個人搞掂，係要好多即係一個 group 一個團隊咧幫助你去更加了解。咁所以咧呢個係依家新嘅方法咧就唔係淨係醫生搞掂你，就係一個團隊咁搞掂你。咁嗱，其實咧我就要依家我用一個可唔可以用呢個 conclusion？就呢個 conclusion 就 sorry.
So patient-centered approach is basically it's very simple. It's American Diabetes Association, European Association of Study Diabetes. That joint statement both in 2012 and 2015. That means in nowadays, patient not just one drug fit all. We need a patient-centered approach towards the management of diabetes. What does this mean about? Start with what we're talking quite a lot of health education by exercise, the diet, and then first drug metformin, and then towards different drug depends on your condition. If you can afford more, then you can consider SGLT2, or you have a cardiovascular risk, you have renal problem, you can use SGLT2. While you have no other complication, and also drug is a drug cost is an important issue for you, then sulfonylurea. After this drug, then you can put on different add on other drug if you're not well under control based on your different condition.
OK， 嗱我講啦，如果 drugs 嗰度方面咧，多數都係第一個咧就用metformin開始先啦。咁用metformin開始之後咧，如果你錢係唔係咁多嘅，咁多數咧做呢個 sulfonylurea 啦，即係如果你metformin搞唔掂啦，咁佢就加藥咧就多數加 sulfonylurea 嘅，即係話介球石啊嗰啲咁嘅藥啦，咁就呢個咧就泵 insulin 出嚟，應該要小心啲，因為呢個咧就會幫你好多 insulin 嗰啲糖咧跌得好快嘅。咁你就會有個 risk 咧就係 hypoglycemia， 即係會低糖啊，忽然間啊。咁但係當我記得有幾個糖友呢度咧都食緊呢隻藥嘅，我都要話俾你聽，如果有呢隻藥咧，即係有個叫做 glycoside 呢個，你應該 always 攞住一隻嘅即係糖啊。有咩事嘅時候，你個手震啊咩，你就要開始食嗰粒嘢啦，因為可能你係介個先。咁另外一個就係 SGLT2 啦，咁呢個咧就冇乜低糖嘅 risk 嘅，咁但係同埋仲有對心臟亦都十分好嘅呢個，咁但係呢個就貴藥嚟嘅，咁所以變咗嚟講咧，可能到私家醫生咧要 subscribe 藥咧，加埋胰島即係加埋metformin咧，呢個食10蚊粒㗎，所以變咗嚟講就會係即係要睇下你咩適合到你啦。
So if you are on sulfonylurea, you need to be aware that this is a very potent drug, but risk of hypoglycemia and weight gain. Yeah.
咁但係如果你真係食緊呢個 sulfonylurea 即係加佢實嗰啲咧，你真係會知道咧就係會加磅啦，同埋咧就有個低糖嘅風險啦。
So simple words for your take-home message. Diabetes itself is a progressive and degenerative diseases and a silent killer because of the heart attack.
OK 嗱，其實咧依家今日聽晒之後咧，仲有一樣嘢就係最重要咧就係記住。糖尿病係一個好長遠嘅病嚟嘅，唔係一個 long-term disease 嚟㗎，唔會停嘅。咁其實亦都有一個係可以講係 silent killer， 即係你唔知嘅，忽然間會即係佢如果你控制唔好，你真係能夠冇乜症狀，忽然間你就會出現，咁你又可能會有生命危險，呢個唔出奇嘅。
And the goal to management of diabetes is a patient-centered approach. For general population, the ABC, the HbA1c, the A is less than 7. If you're a younger age group, that means around 40 or 50 years age, and you have newly diagnosed diabetes, your target should be less than 6.5. While if you're old age, let's say 7 to 80 years old, or have long-term diabetes, more than 10 years diabetes, or have multiple comorbidity, then the A1C control can be more lenient, up to 8. For blood pressure, it should be targeted at less than 130 over 80. For the cholesterol, the bad cholesterol, the low density lipoprotein, it should be less than 2.6 millimole per liter, or American is 100
milligram。嗱，其實我哋有幾個指標你一定要做嘅。第一 A1C 咧，如果你呢啲糖尿病係少過7，一定少過7 ，OK。但係好多時咧，如果你係後生咧，你仲要少多啲喎，少過6.5 ，OK。但係如果年老嘅咧，我哋就放開多啲啦，你 A1C 就低過8 ，OK。咁所以其實咧 A1C 方面咧，呢3樣指數你都要達標嘅，如果唔係就會繼續係令到糖尿病更差。第二樣好重要喺你個血管嘅血壓嗰度咧，就喺度控制要130至80，OK。咁仲有咧個 LDL 好重要咧，就控制到2.6 millimole per liter， 或者喺美國咧係100嘅 milligram per day，OK。
Yeah, so because heavy people is different, so this is called patient-centered approach nowadays. Yeah, depends on your age group, depends on your disease duration and any comorbidity. The target is a bit different for different people, and so because different people have different targets, so ultimately we need to have the tight control of diabetes and every A1C count to reduction of the complication risk.
嗱，其實因為我哋而家已經係即係一個人體嘅管理啦，咁其實好重要咧，就係有不同嘅年齡咧，亦都有不同嘅指標啦，咁你要達到啦。咁仲有一定好重要嘅，即係喺 A1C 嘅控制啊，唔會令到佢即係要令到佢低過頭先所講嘅 number 咧，咁你先能夠降低嘅所謂叫做病人嘅併發症風險嘅。
So the final conclusion of management, remember, eat healthy and smart choice, especially choose the low GI diets, okay? Exercise more and keep active, especially the formula, how to lose more than 3,500 calories per week to lose 1 pound, and also good your diabetes. Drug treatment really help. If you need to put on drug, don't hesitate. Just put on because legacy effect, long-lasting reduced risk of complication. And keep follow monitoring of your disease progress by your general physician or family doctor.
OK， 嗱，其實最後啦，好重要嘅就係要食，真係要食 healthy， 唔可以食嗰啲叫 high glycemic index 嘅東西，好似飯啊啲東西啦，要控制你個碳水化合物嘅食嘅東西啦，即係最主要 rice 啊嗰啲麻麻地啦。咁仲要咧就 exercise， 好多人唔記得 exercise 嘅，食啊記住啊唔記得 exercise。因為 exercise 咧，如果你係 lower 每即係做咗即係1磅嘅減1磅，你要減低3600嘅卡路里嘅食物，即係每日要行大概1個鐘頭嘅東西，咁你先係減到嘅。咁仲有咧，如果食藥咧，醫生話食藥咧就真係最好食藥啦。咁呢個咧就係先能夠控制個血糖。咁其實咧仲有一樣嘢咧，我想問個問題咧，好多堂嘢都問我嘅。佢個問題咧，我用中文講先，用英文啦。咁佢哋咧其實咧就好多人咧就食緊藥嘅，咁但係食藥咧就啲糖唔跌落嚟，咁但係咧唔跌落嚟咧，咁個醫生話我加藥啦咁佢因為係咁加上去，哇嚇到佢傻咗，即係由但係佢藥佢 A1C 繼續7啊、8啊、9啊咁上去嘅，咁變咗嚟講咧，佢食緊藥，譬如食緊頭咧就食咗呢個metformin啦，整緊食雞腦實啦，咁但係個糖都唔跌落嚟喎。咁最後咧，啲人咧就開始驚啦。咁然後佢就識咗我哋啦，就咁樣去糖茶啦。咁飲咗糖茶之後咧，2-3個星期之後咧，啲糖就跌落嚟喎。咁然後咧有啲打胰島素咧，啲糖嘅跌到落嚟咧，減到佢能夠係即係唔使打胰島素喎。咁嗰啲糖友就問你：喂醫生，咁點解咧？I will give you English 啊。We have a lot of patients because I have a lot of patients now who actually in diabetic medication. They usually start on metformin. And eventually went down to glyphosate or other drugs, and the sugar keep going up, and they cannot control it. Doctor said, well, I'm going to add some more sugar, add some more medication for you. So they got really worried. They said, geez, how come? And so at the end of the day, they start drinking our Lowsutea, and they drink, our regular formula, which is like 2 bags a day and 6 times, and they start very quickly, within 1 week to 2 weeks, the sugar start going down, and they start maintaining it. Some even said, oh, doctor said, I can cut down medication. Some even said, I don't need to do my insulin. Matter of fact, a lot of this group of patients actually watching you today, they are like that. So the question to them is it okay? Why is that?
I think it should be okay because basically, to be frankly speaking, I'm a physician. I don't know much about the Chinese medicine, but I know the Lowsutea itself contains some sort of
guava leaf, and bitter melon. 2 things. They are not medicine. They're 100% just 2 natural products.
I've heard about that. Some paper being published before, and that means that the bitter melon and the guava leaf can lower the blood glucose.
That's right. Bitter melons actually act like an insulin, take the sugar into the vessels, into the blood cells. And and the guava leaf actually block the sugar, go into the vessel. So that's how both work, and that's how to lower the blood sugar.
So they have the synergistic effect with the drug. So this one thing, I think this is good. And I don't mind that you put in, and this is one thing. And I just think another point is, if you drink Lowsutea, just like I also drink the tea when I come. And if you drink Lowsutea, by all means, you either drink Lowsutea or drink water. It's replaced other drinks, because many people like to drink quite a lot of sugar drink, the high calorie drink, Coke or that sort of thing. So you replace your drinking other high calorie drink, then this is healthy.
Okay, that's good, because a lot of right now we have so many our friends, our client who actually have high actually blood sugar. And now because they drink Lowsutea, the doctors see really marked effect on the blood sugar because we gave them, this little thing called Ability. They look at it and then they measure it. They say, wow, I'm very good. I'm now 4.3. And they drank that and they're very impressed. And so they are doing good. And matter of fact, I have a customer here, a client here. They actually see themselves, no need medication, no increase in medication, actually decrease in medication. I have another client that 20 years of diabetes. They used to take 2,000 milligram metformin. Now they only take 500 milligram, and they're actually monitored by the endocrinologist. So they're so happy, and they gave them hope. So they were saying that, wow, this is so cool. And a couple of them was in insulin, now need only insulin, only oral medication. So they were saying, hey, is it okay? And you pretty much concur.
Yeah,
it was amazing.
Yeah, it should be fine.
Okay,
but you still need to follow up your doctor.
Yes,
checking.
Yes, they're doing that. They actually continue to, but on the other hand, they also see that the actual really helpful. And I'm happy to. I'm sure you can tell the customer that's okay to continue to take the Lowsutea.
That should be fine because I also drink, even though I do not have diabetes.
Very good. Okay. Now, I don't know the group. Is there any question you want to ask? Can you ask the question now? Maybe, I'm sorry to take a little longer time today, but I thought the message was very important. So I thought maybe perhaps we just talk a little more to give Professor Chen a little more time to talk so you get more information. So is there any question from your end? If you don't have any question, I know the questions are all there already. I mean, we are very comprehensive today, talking today. So maybe if you have any question, you don't have now to think of that, no problem. You WhatsApp me the question or email me the question. I can ask Dr. Chen in the future to answer you. That will be okay too. Any other questions? Okay. Well, if not, then I really appreciate and thank you very much for all your time in a busy Saturday, spending time with us for a couple hours to learn all about the disease. And I'm so happy to start learning that, I pick up a lot of new ideas actually. And it's so important to measure A1C to understand your disease. And a lot of people do not really focus on that. On top of that, they not even focus on measuring blood sugar. And then secondly is smart choice of food is so important. And exercise. 最重要咧，多謝各位堂友啦，今日咧好高興有咁長嘅講座啦，俾我哋啦。今日我了解好多嘢，其實好多嘢都我知道嘅，但係唔記得咗。今日我哋好開心傾到好多嘢。咁然後咧就好多人都話 thank you very much 啊。
Thank you.
Okay. Yeah, it's very good that we got some new idea. 咁好重要咧，其實做要咧真係要記住你嘅 A1C 啦。仲有記住咧，就去度你自己血糖啦，保持你嘅血壓高，唔好咁高啦。同埋第二樣咧就仲有咧係呢個exercise 啦，同埋揀你嘅食物啦，同埋如果要食藥咧就早啲食藥啦。有一個問題講係 How do you know how much sugar to take when your blood sugar is low？ OK， 有一個問題啦。如果你點知你食幾多糖先能夠令到你嗰個 blood sugar 係知道係好低嘅時候，你食幾多糖先知道夠咧 ？So the question is, how do you know how much sugar to take when your blood sugar is low?
I think this is another approach towards this question. I think that the people ask, let's say, I don't know whether I will interpret this wrong. The other way around is, when you find this, you check your cell monitoring blood glucose, and then you find it's very low. Let's say it's around 3, I think 3 or 3 point something. It's very definitely is low. And how much you need to take to convert this or back to normal? Okay, it's simple. We have mentioned about that. Andrew just mentioned to you that you need to have some glucose tablet as your pocket, or you just go quick to drink. Even some people say drink a Coke or even orange juice as much as easy and available. At least a cup of orange juice or just candy, that is already enough to let you back to normal glucose, to go back from the hypoglycemia state to the back to a bit higher stage. Well, if this won't work, then definitely we mentioned about hypoglycemia, you need to call the ambulance. Most of people who have no blood glucose is because they delay the food intake, or they just doing a bit more exercise. While the other people, we mentioned about in short-term communication, the hypoglycemia. If you feel sick, then sometimes you will with relatively poor appetite, not much food intake, while you still continue your insulin injection, then you're putting a bit risky on hypoglycemia. And if you find that your blood glucose is low, even though you just take a bit candy and of orange juice, a cup of orange juice, then this won't work. Then you really need to see your doctor immediately.
OK， 嗱我講過啦，好多人都唔知道啦。原來你話我頭先講啦，每個人都要即係糖尿患病者咧，就應該有個糖嘅有粒糖喺身體嗰度啦。個原因就好多時咧，就係因為你糖跌得低嘅時候，有幾種情況發生嘅。第一，你可能係做好多嘢 exercise， 有陣時驚都有問題喎，即係你個 stress 啊。令到佢糖咧可以即係用晒你啲糖都得㗎，或者你做好啲食都得喎。咁你好多時咧飲杯橙汁其實都夠嘅，或者唔飲夠橙食個糖都 OK 嘅，或者有陣時兩都冇得食個去飲支曲都 OK 嘅，糖曲好高㗎。咁幾樣嘢咧都可能係做呢樣嘢嘅，咁就令到你咧最緊係幫你糖咧由3去到5、6、7啊嗰啲咁東西啦嚇。咁呢個就幫助呢樣嘢。仲有冇其他問題咧？ Are there any more questions? Well, if not more questions, I will really thank you very much for the wonderful lecture of Dr. Chan, Professor Chan, to give us this a really thorough, very informative webinar. Greatly appreciate that. And I gained a lot, actually.
Thank you so much. Thank you so much.
And then we will, I know there's a lot of people also will see, because there are a lot of people written to me, I cannot join because they're working or whatever. The tape recorder will be recorded and will be basically mailed to them, so they'll be okay. Okay, thank you very much, everybody. Appreciate your support, and I'll see you then. Take care. Oh, I said,